Hello, and welcome to USA Today's The Excerpt. I'm Dana Taylor. When we think about healthcare, we tend to focus on the medicine, the machines, the doctors. But what if the design of a hospital room could play just as big a role in how we heal? There's a growing body of research showing that our physical surroundings, especially those that connect us to nature, can have a significant impact on patient outcomes. The concept is called biophilic design, bringing elements of the natural world into built spaces. And hospitals, it turns out, are starting to take notice. Can better design of medical settings be the secret to unlock a better and faster recovery? Here to explore this idea with us is Dr. Maddock, a professor of public health at Texas A&M University and a leading expert on how our environments shape our physical and mental well-being. Dr. Maddock, thanks for joining me today.
Thanks, Dana. Happy to be here.
Hospital environments are often cold, sterile, and high stress. What kinds of environmental cues seem to make the biggest difference in improving a patient's mental or emotional state, which of course will contribute to a faster healing timeline?
Yeah, that's a great question. Since the 80s, we've actually seen research that the view out the window probably makes the biggest amount of difference. The earliest study looked at people with a view of a park-like setting compared to a view of another building. And they found that people with the view of the park-like setting got out of the hospital faster, used less painkillers, and had less post-op complications. And so just that view seems to make a huge difference. The issue we run into is, of course, a lot of hospitals already built, and they don't have windows, or they're in the middle of a big medical center that's got other buildings that they're looking into.
What do we know about how exposure to nature affects the brain? For instance, are there changes in brain activity, hormone levels, or emotional regulation?
There's a lot of science now coming out around brain science and kind of what happens in what we call microdoses compared to macrodoses. So just 10 minutes of exposure to nature resets your ability to pay attention. And they actually see the part of the brain related to executive functioning actually shuts off and takes a break when you're in nature. And so that kind of attention restoration is real quick. With about a 45-minute exposure, we see things like rumination, which is thinking the same thoughts over and over again. That part of the brain turns off and gets us away. So if you're experiencing PTSD or other traumatic events, it's rumination is one of the main symptoms of that. And so being able to stop that is really important. In longer term dosages, we'll see something called forest bathing, where people are present in nature for up to a weekend. It actually affects their immune system, improving natural killer cell activity, which is our body's ability to fight cancer. And this effect lasts for up to a month, which is really amazing.
Dr. Maddock, you recently co-authored a study that demonstrated how even simulated nature like digital plants or virtual green views can help reduce stress. What's actually happening in the brain when we see these natural elements?
Yeah, it's very interesting. All of five of our senses, when exposed to nature, there's a positive effect. But sight is the most powerful one. And so in times when we can't get into real nature, we can use virtual reality. And we do see a kind of a somewhat attenuated, but still a real effect of just sights of different things. So we looked in a hospital room and we looked at the differences with views out the window that were unobstructed versus seeing another building. We added plants to the environment, looked at the effect of plants. We even added green paint to the walls. And all of these created this real relaxation and kind of both mental and physical clarity and relaxation.
If we were to fully integrate biophilic principles into hospital design, what kind of evidence-based impact could we expect on patient outcomes? Fewer meds, shorter stays?
I think we've seen all of those things. I think you hopefully have less complications. Hopefully you get out of the hospital faster. Hopefully that, you just improve just your overall mood and experience. We see that a lot of people that we put into these biophilic rooms and they say, well, I actually had a better experience. We had a virtual reality intervention in an oncology unit when folks were coming in and getting their chemotherapy. And those in the biophilic room and those with the VR reported less distress than people in a traditional room. And so trying to improve the experience for the patients and hopefully speed healing is kind of one of the main things we're looking at.
Beyond patient recovery, how might biophilic design affect healthcare workers, nurses, doctors, or janitorial staff who spend long hours in these spaces, oftentimes without much or even any natural light?
I think one of the main things we've seen in healthcare is this high level of burnout. And we're really trying to explore how we get more nature exposure to our healthcare workers. And so one of the projects we're working on right now is a rooftop garden that will be designed for patients, family, and for staff, and really trying to get folks out into nature. I've been working with a group at Houston Methodist Hospital around trying to get healthcare workers breaks in nature, and how do we facilitate that? How do we encourage it? And it really does, that attention restoration, that lift of mood. A lot of those things can break up a real long workday in a very short amount of time. 5 to 10 minutes makes a big difference. And so making sure it's accessible to healthcare workers, that we have nearby nature, which is easy to get to.
Some hospitals may not have the budget or flexibility to add real plants or build window views. What low-cost or scalable biophilic interventions could still deliver benefits?
We're actually going into a randomized trial later this year in our oncology unit, and we're using fake plants. And we're using fake plants because, with a compromised immune system, having real plants could be a problem. And so it's a one-time cost. It's not expensive to add some plants to the room. We're also adding nature sounds, so recorded sounds of birds, of waterfalls, et cetera. And we're going to look at how effective those are. So this can be some really inexpensive ways of, taped nature sounds is a very cheap way. If there's TVs in the room, having a TV that can be turned to a nature station can really make a big deal versus, watching kind of the normal TV channels.
Humans evolved in natural environments. From a public health perspective, what does the research say about how our disconnect from nature is affecting us more broadly, especially in urban settings?
If you look at what's happened in the last 50 years, especially the last 15 years, we've really removed ourselves from the natural world. I know when I was a kid growing up, it would be usual to spend 8 to 10 hours a day outdoors in the summertime. And now it's very hard to find kids that are outdoors. And the vast majority of Americans, over 75% of Americans, report spending less than 10 hours a week in nature. And this has been called nature deficit disorder. And what's happening is that, the levels of stress that we get, we don't have this natural way to kind of reduce stress. And so we tend to be in that fight or flight mode all the time. And we know that leads to things like heart disease, like overeating, not exercising enough. So the rises in obesity that we're seeing, and anxiety and depression, all these things are going in the wrong direction. And it seems to be at least in part tied to a lack of exposure to natural environments.
We hear a lot about the mental health side of nature exposure, but what about the physical side? How does access to green space affect things like heart rate, blood pressure, and immune response?
Yeah. So really you get this effect of, within that 10 minutes, your heart rate goes down, your heart rate variability goes up. You just have this great change in mood. And then, as I talked about earlier, that immune function, with a little extra time in nature, might take a full day of being, fully present in nature. We see a difference. And one thing that really is important that we talk a lot about is presence, right? And so if you're going out into nature and you've got headphones in and you're looking at your phone, you're not really going to get the benefits of nature. But spending that time to really listen to the birds and look at the different flowers and breathe in the fresh air and really I'm here and I want to be here and I'm present in nature. That seems to have the most effect on people and does have a really big physical effect. We also find that people tend to be more active when they're in natural environments, especially for children. If you let kids outside, they run around just naturally. And so you get that benefit of physical activity also with being outdoors.
We're seeing increasing rates of burnout, anxiety, and mental fatigue in modern life. Do you think part of that comes from a lack of natural interaction in our built environments?
I totally do. And so there's this thing called the biophilia hypothesis. And what it says is that human beings are naturally connected to other living organisms. And I like to put this into 3 buckets. Human beings are naturally connected to other human beings. And we know the previous Surgeon General said we have a loneliness epidemic in the United States and that we're not connected to each other. Human beings are naturally connected to domesticated animals, our dogs or cats, even we're doing equine therapy with horses right now to connect people to domesticated animals. And then human beings are naturally connected to the natural world. And, we've had such a reduction in that. And so I think those are the natural ways that we can reduce our overall levels of stress. But as we've gotten more and more in front of devices and more busy and everything else, those have been cut out. And I think we need to reshift and reconnect with all 3 of those.
Looking forward, what are the most exciting or unexplored directions for this field? Where do you hope this kind of research goes next?
There's so many different benefits of nature, and we're just starting to unpack how it affects the body. One thing is there's been some initial studies on the gut microbiome. So when people are in the soil, whether it be gardening or kids playing in the dirt, that seems to improve their gut microbiome, which is an area we're really, at the early stages of figuring out. The next area that's really exciting is the effect of sunlight on the body. So for years in public health, we've told people protect yourself from the sun, don't get too much sun, etc. And there's two big studies, one from the UK on the British biobanking study, where they followed people over 10 years with tissue samples, and they looked at how much UV exposure they got. And they found that people with higher levels of sun exposure had lower all-cause mortality, so less likely to die, lower cardiovascular mortality, so less likely to die from a heart attack, and lower cancer mortality. So even though we're super worried about melanoma, it only accounts for 1% of cancers. And so the kind of anti-inflammatory effect of UV actually reduces all these things. And so while we never encourage anybody to get sunburnt, getting a little more sun actually might be good and being part of nature. And so our big thing right now is try to unpack all the different benefits that come from nature, and then making sure that we have equitable access for everybody across our country so that everybody can get that time into the natural world.
Dr. Maddock, thank you so much for being on The Excerpt.
Thank you. It was great to be here.
Thanks for watching. I'm Dana Taylor. I'll see you next time.